Hello guys, my name is Arslan Iqbal and I am doing my MBBS from OS International Medical University, Kyrgyzstan. Today my topic is cyprahepatodin. First of all, its summary. Cyprahepatodin is combined serotonin and histamine antagonist used to treat the allergic symptoms for appetite stimulation and off-label in treatment of serotonin syndrome. Its generic name is cyprohepatadine. Now its background. Cyprahepatadine is potent competitive antagonist of both serotonin and histamine receptors. It is used primarily to treat allergic symptoms, though it's perhaps more notable for its use in appetite stimulation. Now its chemical formula. Its chemical formula is C21H21 and N. Now its indication. In the United States, prescription cyprahepatadine is indicated for the treatment of various allergic symptomatologies, including dermatographs, rhinitis, conjunctivitis, and urticaria, as well as adjunctive therapy in management of anaphylaxis. Now, after that, we have mechanism of action. Cyprahepatadine appears to exert its antihistamine and anti-serotonin effects by competing with free histamine and serotonin for binding at their respective receptors. Now its absorption. A single study examined the difference in absorption of orally administered versus sublingually administered cyprahepatadine in 5 healthy males. Now its metabolism. The principal metabolite found in human urine has been identified as quaternary ammonium glucuronide conjugate of cyprahepatadine. Now its toxicity. Overdose of cyprahepatadine is likely to result in significant sedation, although paradoxical stimulation has been noted in pediatric patients, and anticholinergic adverse effects such as dry mouth and flushing. So that's it about all cyprahepatadine, and thank you.
I am a student of OS International Medical University, Kyrgyzstan. Today my topic is drug. First we know about what is drug. By definition, drugs are chemical substances that affect or alter the physiology when taken into a living system. After that, we talk about some drug like opioids and cannabinoids. First, we discuss about opioids. Opioids are the drug which bind to a specific opioid receptor present in our central nervous system and gastrointestinal tract. Heroin, commonly called smack, is chemically diacetylmorphine, which is a white, odorless, bitter crystalline compound. This is obtained by acetylation of morphine, which is extracted from the latex of poppy plant Papaver somniferum, generally taken by snorting and injection. Heroin is a depressant and slows down body function. It is the chemical structure of morphine in this methyl group attached in this ring, and this is the opium poppy plants. After that, we discussed about another drugs, that is cannabinoids. Cannabinoids are a group of chemicals which interact with cannabinoid receptor present principally in the brain. Natural cannabinoids are obtained from inflorescence of the plant Cannabis sativa. The flower top, leaves, and the resin of cannabis plant are used in various combinations to produce marijuana, hashish, charas, and ganja, generally taken by inhalation and oral ingestion. These are known for their effect on cardiovascular system of the body. Thanks for attention. My name is Asif Jamal. I am a student of OS International Medical University, Kyrgyzstan. Today my topic is drug. First we talk about the definition of drugs. A drug is any chemical substance that causes a change in an organism's physiology when consumed. Drugs are typically distributed from food and substances that provide nutritional support. We all know that there are so many drugs, but today we talk about only two drugs, that is cannabinoids and cocaine. First we discussed about cannabinoids. Cannabinoids are a group of chemicals which interact with cannabinoid receptor present principally in the brain. Natural cannabinoids are obtained from inflorescences of the plant cannabis sativa. The flower tops, leaves, and the resin of cannabis plants are used in various combinations to produce marijuana, hashish, charas, and ganja, generally taken by inhalation and oral ingestion. These are known for their effect on cardiovascular system of the body. This is the skeletal structure of cannabinoid molecules. In this structure, OH group attach in their rings, and it is the leaves of cannabis sativa. After cannabinoid sativa, we are talk another drug, that is cocaine. Coca alkaloid or cocaine is obtained from coca plant Erythroxylum coca, native to South America. It interferes with the transport of the neurotransmitter dopamine. Cocaine, commonly called coke or crack, is usually noted. It has a potent stimulating action on central nervous system, producing a sense of euphoria and increased energy. Excessive dosage of cocaine causes hallucination. Other well-known plants with hallucinogenic properties are Atropa belladonna and datura. These days, cannabinoids are also being abused by some sport persons. Drugs like barbiturates, amphetamines, benzodiazepines, and other similar drugs that are normally used as medicines to help patients cope with mental illness like depression and insomnia are often abused. Morphine is a very effective sedative and painkiller and is very useful in patients who have undergo surgery. Used for hundreds of years in folk medicine, religious ceremonies, and ritual all over the globe. When these are taken for a purpose other than medicinal use or in amount or frequency that impairs one physiological function, it cannabinoid constitute drug abuse. Thanks for attention.
My name is Mohsin Haider. I am a student of OS International Medical University, second year. Today I am discussing about drugs named albendazole. Albendazole is used to treat infection caused by worms. It works by keeping the worm from absorbing sugar, glucose, so that the worm loses energy and dies. This medicine is only available with doctor's prescription. Use of albendazole. Take this medication by mouth with meals as directed by your doctor, usually 1 to 2 times daily. In form of child 200 mg and for adult it is of 400 mg. If you or your child have trouble in swallowing tablet, you may crush or chew your dose and take it with water. Side effect: nausea, vomiting, abdominal pain, headache, or temporary hair loss may occur. If worse, tell your doctor. If someone has overdosed and has serious symptoms such as passing out or trouble breathing, contact to poison control unit. That's all. Thanks.
My name is Arfin Asgar. I am a student of OSH International Medical University. Today my topic on drugs. First we discuss about the what is drugs. By definition, drugs are chemical substances that affect or alter the physiological when taken into a living system. After that, we know that there are so many drugs, but today we talk about only two drugs, that is opioids and cocaine. Opioids are drugs which bind to specific opioid receptor present in our central nervous system and gastrointestinal tract. Heroin, commonly called smack, is chemically diacetylmorphine, which is a white, odorless, bitter, crystalline compound. This is obtained by acetylation of morphine, which is extracted from the latex of poppy plant Papaver somniferum, generally taken by snorting and injection. Heroin is a depressant and slows down body functions. It is the chemical structure of morphine. In this methyl group attached in this ring, this is the leaves of opium poppy. After that, we discuss about another drugs, that is cannabinoids. Cannabinoids are a group of chemicals which interact with cannabinoid receptor present principally in brain. Natural cannabinoids are obtained from inflorescence of the plant cannabis sativa. The flower top, leaves, and the resin of cannabis plant are used in various combinations to produce marijuana, hashish, charas, and ganja, generally taken by inhalation and oral ingestion. These are known for their effect on cardiovascular system of the body. Thanks for attention.
My name is Tasir, student of OSIMU. Group 2B, drugs for anxiety. Fear, anxiety, phobia. Anxiety is a mental state wherein a person develops unease or nervousness in anticipation of a future events. For example, an unpleasant feeling experienced by a student before exam is anxiety. Drug. Benzodiazepines. They include clonazepam, chlordiazepoxide, and alprazolam. The drug of choice for acute anxiety are benzodiazepines. Fast onset of action. They cause CNS depression is reduce anxiety. Can benzodiazepines can be used to treat a chronic anxiety? No. They include dependence, tolerance, and sedation. Consequently, patient dependent highly on them to feel better, and the dose for the desired effect increase with us. Second group of drugs are 5-HT1A partial agonist. They include buspirone, gepirone, and epsipirone. They are used to treat general anxiety disorder. Mechanism of action. The drugs partially increase the activity of the 5-HT1 receptor, reducing the release of 5-HT. Reduce anxiety. Advantages: no dependence, no sedation, no tolerance. Disadvantage: do not act fast, ineffective in managing acute anxiety.